seminar by Ms. Eji Amin about confronting gender-based violence by and on healthcare. Ms. Eji Amin is a Gender and Population Development Program Analyst at UNFPA, and she will be joining us today to present her amazing seminar. Thank you so much. Please join us on the stage.
Good morning, everyone, and thank you for joining us for today's presentation. In the upcoming 20 minutes, I'm gonna do a presentation as representing UNFPA, United Nations Population Fund office in Iraq, on confronting and preventing gender-based violence among the health professionals. I will start my presentation with a definition about the gender-based violence, or we call the SGBV, which is an umbrella term for any harmful act or practice that's be perpetrated against any person's will, whether this person is a male or a female. Of course, this definition, the types of the SGBV, is different from cultures to the countries to the regions. We, on daily basis, every single person of us might experience a type of the SGBVs or violences in his or her life. So I'm gonna focus on the core type of SGBV, or gender-based violence. I will start with the rape, which is the definitions that we see that those are the type of the SGBV that's repeated in many countries and in many regions. The rape is the definition of the rape is a non-consensual penetration of the vagina, anus, or a mouth with the penis or other body parts. Also include the penetrations with an object. This is, we believe, that the worst type of the SGBV, or the violence that will be perpetrated against a person. While the sexual assault is any form of non-consensual contact, those does not result in or includes the penetration. We have a type of unwanted kissing, for example, fondling, touching of the genital or buttocks. So whatever doesn't include the penetration, but this is unwanted or not willing of the person, it will be counted as a violence and under the sexual assault. We have the female genital mutilation as classified as a sexual assault. Why? Because this type is a violence that impacts the sexual organ of the female. So it's classified under the sexual assault. The physical assault, it's any type of forces, a physical force, a physical touch that's injured or hurt the opposite of the body of the person, and the person will feel pain, like the example of hitting a person, example of cutting or soothing, or even the acid attack of the person. It counted as a physical assault, which results as to pain the person. So psychological and emotional abuse. Many people are facing the psychological and emotional abuse through many different type of acts. We have the infection, it says the infection of the mental or emotional pain or injury. The threat of the physical or sexual violence. We have the example of harassment, unwanted attention, remarks, disruption of the greased things, sometimes gestures or written words. Sometimes people are receiving different type of messages that create for them a kind of emotional abuses. The denial of resources and opportunity of services is another core type of the GBVs. So the denial of the right of the access for the person to any type of the services or wanted of the person, whether it's economic, whether it is health, whether it is education, whether the person who has prevented for receiving inheritance. So those are also other type of the GBVs that affect the person. The last thing that we have in the core type of the GBV is the forced marriage. So the forced marriage is for an individual against her or his will. So we are not saying only the forced marriage for the ladies, sometimes for the women. Sometimes we have forced marriages for the men as well, when the family is forcing him to get married at his earlier age. So this is another type. So those are the 6 types of the core GBV that we found that are important that to be presented. So the background, the gender-based violence is a pervasive public health and human rights problem throughout, of course, the world. Though the patterns and prevalence of the violence vary from one place, it's different from, as we said, it's different from one place to another place. According to the CAP study that has been conducted by the Kurdistan Health Summit very recently, they approached 500 individuals, health service providers, from physicians, pharmacists, and nurses in the public hospitals in the Kurdistan region, in Erbil, Duhok, and Slemania. They came out with the following results. The healthcare providers, they reported that 97% of the GBV is widespread in the Kurdistan region, while 70% responds that there is no dedicated services for the survivors of the gender-based violence in the Kurdistan region. The GBV is widespread among the women and girls. 92% they say that. And the 88% of response say that women access to the GBV services is not easy. We know that, and it's very obvious in our region, we are hearing on daily basis different type of GBVs. But does everybody is reporting? Does everybody is going to ask for her right or his right? Because services is not easy in the region. 73% of women and girls has experienced psychological abuse, like verbal abuses, neglecting, isolation, etc. We are seeing on daily basis different type of psychological abuses, like when you are on the street, when you are addressing something, the others are not happy, so they will tell you something which you are not happy with. So the last thing is, say 67% respond that there's a weak social support for the survivors of the gender-based violence. So here we are saying why GBV is a health issue. According to the studies that confirm that GBV has a severe health-related consequences. It can reach to the death, like homicide and suicide. That's the type of or a non-death, such as chronic pain syndrome, traumatic injury, or traumatic gynecological fistula. So these two, those are the studies that they say the effect on the health. So during the pregnancy, violence may threaten the life of the woman and the child before birth, because then the GBV has a relation with the health. Also, physical violence during pregnancy might lead to the miscarriage, the premature labor and birth. It might also reach to low birth weight or many other type of the consequences. System. The service delivery have different ministries here that we need those people to be institutionalized with the GBV and the core type of the GBV. So in order for them to respond to the GBV situations whenever they face it or confront it. Strengthening the policy environment, this is very important. Essential skills and capacities for an effective GBV health response. All the health service providers, of course, they will need every often to get training, to gain new skills because lives has changed, different things has occurred, so it's very important. And then strengthen coordination and collaboration among the health service providers and whether it's government or non-government institutions, which this is very important. Lastly, we as United Nations Population Fund working on delivering a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Thank you very much.